Hi, folks. Welcome. I'm just going to read a few housekeeping things and then we'll hand it over to get started here. It's the first time we're doing this as a hybrid event, so I'll just mention a few things before we begin. The seminar is being recorded and the recording will be shared after the event. So please use the chat function if you're online at the bottom of the screen to share your thoughts at any time. And if you type anything into the chat, it will be public, so don't share anything personal. And also, if you can hit your mute if you're on Zoom until there's a time where you might want to speak up. But otherwise, let's aim to keep it on mute and we'll do great. So we've got folks in the room and on Zoom. I'll hand it over to Dr. Kishore Mulpuri.
I mean, most of you know Joel, if you're wondering who that was, and that's Joel Sloan, our Managing Director of Research, and Joel joined us a few years ago, and it's certainly been a game changer for us, and you will see throughout the presentation some of the amazing work that's being done, and certainly Joel brought a whole new dimension to, I think, our research management that we didn't have before. So hello, everyone. I'm Kishore Mulpuri. I'm one of the orthopedic surgeons that works at Children's Orthopedics, and I work with some amazing people, and together we call ourselves Hippies, and our lab is a Hippy lab, and the main person that kind of leads our Hippy lab really is Emily, and working very closely with Joel, and the two of them take all the credit for leadership that's shown with many other people. And before we get started, I'd like to acknowledge that I'm speaking to you today from unceded, traditional, and ancestral territories of Musqueam, Squamish, and Tsleil-Waututh nations. I know some of you are joining us from across British Columbia and also around the world. So I would like to extend this acknowledgement, gratitude, and respect to all the communities from which you may be joining us today. And I'd like to just refresh a little bit about our mission and our vision. Our vision is very simple. It is hip health for all. It doesn't matter where they live and where those patients and families are, that really we're working towards hip health for all. Our mission is to improve hip health and mobility and quality of life for children in British Columbia, nationally and globally. And how do we do this? We do this through research, clinical care, education, and advocacy. And if I could draw on one kind of thing that unites all of us and drives us, and really the one that we're all really excited about, is a lot of the programs that have started here locally have gone globally. And if ever you think that we're giving something to the world, we actually learn a lot from them and bring them back. There are some programs that we are either exposed to or we're involved globally, and we've actually brought these local learnings, their global learnings, back to locally, and we're implementing those programs here. So truly, this team doesn't get involved. I mean, obviously, we do everything we can to improve care for children in British Columbia and Canada, but once we go beyond Canada, if the impact is not far and wide, that's not a priority for us. Either it has to be very relevant first locally for us in BC and in Canada, but if we go beyond that, it's only relevant to 4 nations, and we're typically not participating or interested in those, because I think we owe it, especially when we talk about in the current day about equity, diversity, inclusion, respect, and accessibility. We have a lot of children and families that are incredibly disadvantaged. And we have a lot of people that are working right now in testing times in places that are less than optimal, trying to improve care. And we need to work with them as much as we work with anybody else. And we need to learn from them. So that's really the philosophy of this group. And none of this would be possible without an incredible amount of collaboration and generosity and support that comes from a number of different organizations. Obviously, if you have to single out one unit, and that's I'm a Hippy, who's been our biggest funder so far in supporting our vision, and BC Children's Hospital Foundation and the Research Institute here in UBC are really the places and the home for us to be doing this work. And some of our other major donors are Peterson Group and Family and Monday Family and many others. As you can see, our support and donors come from all around the world. And an example is Divi's Foundation for Gifted Children, which is based out in India, supports a lot of our programs now in India, including our new collaboration with UNICEF. So with that, I'd pass on to Emily, who is really our scientific lead and our research director, to really walk through different areas of study that we have and the progress, the contributions this team has made working with many others around the world in this past 12 months. Thank you, Emily.
Great. Thanks so much, Kishore, and thanks everyone for joining today, either in person or virtually. As any return attendees of our previous open houses know, the work you're going to hear about right now is due to the incredible dedication of our entire team and our many collaborators. So I may have the privilege of standing up here and speaking about it, but every single team member makes invaluable contributions to making us successful. So thank you to our coordinators, our co-op students, our volunteers, our funders, our clinic team, and of course, our incredible patients and families. So as a lab, we focus on a number of different areas of pediatric orthopedics, but above all, we study conditions impacting the hip health of infants and children. These include developmental dysplasia of the hip, or DDH, hip displacement and cerebral palsy, slipped capital femoral epiphysis, or SCFE, and Perthes disease. And all of these conditions impact children's hips at different stages of development and in different ways. But there are also a number of other hip conditions that are much less common and fall into our rare hip conditions category. And additionally, we also study pediatric musculoskeletal trauma, such as fractures and other injuries, and how they impact kids. So the primary way that we go about doing this research is through registries or research registries. So our registries gather both clinical and patient-reported outcomes data with the intent of providing data that can help advance not only research, but also clinical care, education, and advocacy. So on the scale in which we're conducting our registries, we also aim to impact global health and drive innovation. As such, the Hippy Global Registry Program was born with a mission to improve outcomes and quality of life for children and families, not only here in BC, but also around the world. And the Hippy Global Registry Program has really grown organically from our local to global collaborative approach, as Kishore mentioned. We now have 2 condition-based registries that are well established and continuing to grow: the Global Hip Dysplasia Registry, or GHDR, and the SCFE Longitudinal International Prospective Registry, or the SLIP Registry. And on the backs of their success, we have also recently launched Global POISE, or Pediatric Orthopedic Implant Safety and Efficacy. And we have 2 more global registries that are in varying stages of initiation, which I'll speak to in a little bit. But the scope of these registries has become truly global. We have over 6,500 patients now recruited across all of our active registries, with 63 different centers that are contributing data from 17 countries and across all 6 inhabited continents. And our collaborators come from hospitals and universities the world over, and we are constantly looking to improve our global representation. So it's truly a privilege to work with our wonderful collaborators, both internally and in the UBC environment, as well as globally. And that especially includes our vitally important contributions of our participating patients and families. So our founding registry, as many past open house attendees will know, is the Global Hip Dysplasia Registry, or GHDR. And this registry aims to optimize treatments and outcomes for infants and children with DDH worldwide. In 2023, we crossed the 6,000 patients recruited threshold, and we're now well over 6,100 patients as well. And we added representation from the continent of Africa. So we brought on board centers from Uganda and Kenya. And this sort of representation and volume of patients now is setting us up to start to answer some really long-standing questions in the field about diagnosis, treatment, and outcomes of DDH in a truly globally relevant manner, not just applicable to the global north. But we also developed GHDR not only with the vision of a prospective registry for children with DDH, but also for the purpose of developing targeted hypothesis testing studies, like randomized control trials with specific questions that could be performed under the auspices of the larger registry with our collaborators. And so to that end, excitingly, we recently received a CIHR project grant to examine one of those specific questions, bracing versus observation in radiological dysplasia. And we hope that this will provide strong evidence to improve management of infants with DDH in a globally relevant way. We also envision that this is a model of hypothesis generating registries fueling hypothesis testing RCTs and comparative effectiveness studies as the foundation of our research program to maximize the impact of our research on improving and advancing clinical care worldwide. So our next registry is the SLIP registry, or the SCIFI Longitudinal International Prospective Registry. And it's aimed at determining optimal treatments for children and teenagers diagnosed with the hip condition of SCIFI. This year, SLIP continued to gain momentum. We surpassed the 450 patients recruited mark across all of our centers. We also added 4 new centers from 3 countries, 2 of which hadn't been previously represented in SLIP in the past, from Uganda and Brazil. We also had the first of our research from the SLIP group be presented at both international and national conferences this past spring, with our very own Dr. Bryn Zomar presenting at the Canadian Orthopedic Association. And so we're looking forward to many more productive research studies to come from SLIP as we go forward. And I mentioned perhaps one of the most exciting events that happened for us this year was the official launch of the Global Pediatric Orthopedic Implant Safety and Efficacy Registry, or Global POISE. This is a really exciting addition to our program, but is truly a joint effort between the Hippy Lab as well as the International Limb Differences team led by doctors Tony Cooper and Harpreet China. So many orthopedic injuries and conditions require implants to fix fractures or properly align bones, and therefore understanding how safely they do their job and how effectively they do their job is critical. And so our incredible research associate, Dr. Bryn Zomar, has put in many blood, sweat, and tears into the build of this project, along with huge amounts of energy and effort and motivation from our managing director, Joel Sloan. It's being managed impeccably by our coordinators in Lee, as well as team members on the ILDN side, and would be remiss without mentioning the huge efforts of the UBC data management team to get this up and running as well. So this has been truly a remarkable process to see this come to fruition. We are working with OrthoPediatrics, which is a main manufacturer of orthopedic implants for kids, to develop this global registry. And this whole point of POISE is aimed at understanding the outcomes of these implant devices. We have now recruited 43 patients here at BC Children's across the Hippy Lab, the Limb Differences team, and Dr. Lisa Bay's clinic. We also hit a major milestone launching this incredibly complex system to our external collaborators. We have another site now that's actually actively recruiting, which is Orlando Health. And again, thank you to our incredible partnership with the UBC data management team. I think some of you are here today, so thanks for coming. Okay, and so we have, as I mentioned at the beginning, we have 2 other research registries that are in the works. The first is Global Ped Ortho, which is a pediatric musculoskeletal trauma registry that expands on an existing trauma registry partnership that we run with the AO Foundation in Switzerland. We plan to initially focus on developing the registry around traumatic hip dislocations and femoral neck fractures in children before expanding to other injuries. And the second new registry we're looking to launch is the Rare Hip Conditions Registry. And a lot of this groundwork has been, sorry, the mouse cursor disappeared. Okay. And so a lot of this groundwork has been done by one of our past co-op students, Sheila Lamb, and one of our orthopedic fellows, Dr. Haley Spur. So with this registry, we aim to better understand some of the multitude of more rare hip conditions that are not nearly as studied as DDH and SCFE and Perthes. And due to the relative smaller patient number that get these conditions, it's been historically difficult to study these conditions. And so really this is where we can capitalize on all of our global collaborations. And so key activities this year, we've been working towards launching, piloting this registry with 3 or 4 main conditions to start with: the hip in Rett syndrome, the hip in spinal muscular atrophy, the hip in Down syndrome, as well as the hip in sickle cell disease, which came about by feedback from our global community wanting to look at these conditions. And so now that I've touched on all 5 of our research registries in the Hippy Global Registry Program, I just want to, before moving on, highlight the incredible clinical program we have. So a huge part of the Hippy Lab team is the wonderful clinical care team who tirelessly provide patients with fantastic care. And a vital component of this care for our patients with cerebral palsy and other neuromuscular conditions. And so this program, the CP Hip Surveillance Program for Children with Cerebral Palsy, has been spearheaded by our incredible physiotherapist, Stacey Miller, and has really transformed the way that children with cerebral palsy are screened and surveilled and monitored for hip displacement over time. And it has actually changed surgical practice in the province, almost eliminating the need for more complex salvage surgeries and intervening early before that is necessary. My cursor has disappeared, Tamara. Do you have? How do I get it back over to the screen? Oh, it's over there. Thank you. Thank you. No difficulties. Thanks. All right. Okay. And so beyond our work with the Hippy Global Registry Program, we also actively contribute to other ongoing studies and registries that are led by some of our global collaborators. And the work that we do here is really kept up by our amazing co-op students that do all of the data collection and patient recruitment in clinic. And so some of these studies that we contribute to include the International Perthes Study Group that's run out of Texas Scottish Rite Hospital, and the CP Hip Outcomes Project that's run out of the Hospital for Sick Children in Toronto. Another major area of focus for the Hippy Lab has stemmed naturally from our registry program and our collaborations built that way. And that's the development of care pathways. So a care pathway uses the best medical and research evidence to standardize or create a map for the diagnosis, management, or treatment of a given condition. Perhaps most importantly, though, a care pathway is region-specific, understanding that care solutions that work in one area of the world may not be applicable or work in another area of the world. And this diagram here represents just one such example of a care pathway that our team has developed with many global collaborators over time. So for those of you who've attended previous Hippy Lab open houses, you've heard about the collaborative work our team did with societies in India to develop 2 care pathways there, one for DDH and one for the surveillance of hip displacement in children with cerebral palsy, or CP. This successful collaboration has led to an expansion of our care pathways program, and we are now hard at work supporting context-specific care pathway development in Sri Lanka, China, and Brazil. Notably, we recently wrapped up the consensus process in Sri Lanka, and this was spearheaded by a Sri Lankan pediatric orthopedic surgeon, Dr. Sunil Wijaya Singh, and our very own now grad student, previous co-op student, Denisha De Silva, really carried this project forward. Having been a part of these global care pathway development processes, we are now in the process of bringing the lessons learned in these global endeavors and applying them locally here in BC and in Canada. We are currently working with pediatric orthopedic surgeon Dr. Sukdeep Dalai on developing national guidelines for DDH screening in Canada, while incredible nurse practitioner Elisa Robinson is spearheading efforts for implementation of guidelines in BC. And the potential impact of these care pathways is immense. That potential was recently recognized by UNICEF. So they have pledged $1.2 million toward implementation of the DDH care pathway, as well as some autism work developed for India. And they were starting with rolling out this implementation of the care pathway developed in 4 states in India. But this partnership also holds great promise for future implementation support as we develop care pathways in Canada, as well as other regions of the world. And so shifting gears a little bit, education and knowledge exchange is another leading tenet of the Hippy Lab. And we recognize we have so much to learn from our global collaborators and rich experiences to share amongst them. To that end, we have been so grateful for the support of both I'm a Hippy and the Peterson Fund for Global Hip Health to fund separate traveling fellowships or scholarships to facilitate such knowledge exchange. So this July, we welcomed Dr. Patricia Moreno as the inaugural Russell G. Smith Traveling Fellow. This was an award established in memory of the very first I'm a Hippy board chair, Russell G. Smith, by his family. Dr. Moreno is a pediatric orthopedic surgeon from Sao Paulo, Brazil, and she is an integral collaborator of the Hippy Lab. She contributes to our Hippy Global Registry program. She is an active pillar lead in our Hip Hope Network, which you'll hear about in a little bit, as well as numerous other studies. And she's truly a force of nature. She's incredibly passionate. She's dedicated to the same mission and vision of the Hippy Lab. And so it was an extremely rewarding experience to have her come and visit and exchange those ideas and set up new collaborations in the summer. Likewise, in August, we welcomed our first Peterson Scholar for Global Hip Health, Dr. Sukdeep Dalai. So Dr. Dalai is a pediatric orthopedic surgeon at Stollery Children's Hospital in Edmonton, Alberta. And Dr. Dalai is a trailblazer in the field of pediatric hip health, especially in Canada. And she's actually the second president-elect for the Canadian Orthopedic Association. She came and spent the month of August working with the Hippy Lab here to develop educational materials about hip health aimed at community workers, healthcare providers, and patients and families in rural, remote, and underserved regions of the world. So she's actually, I believe, currently in Chhattisgarh, India this fall to implement these materials and teach and train healthcare workers in that region. So we're really excited to refine and utilize these materials in other regions of need around the world to make an enormous impact on the care for children with hip conditions. And Sukdeep is also working closely with us, as I mentioned, on the Canadian DDH care pathway guidelines. And so she has worked with a number of our students as well. She worked with Manita and Tarini and Sam. We'll be working with her as well for this future work. And so these sort of connections established and made possible by Peterson and by I'm a Hippy have been incredible to sort of further that knowledge exchange on a global scale. And that sort of brings us to combining all facets of our team's mission. We have the Hip Hope Network, our hip health outcomes in pediatrics. This network really aims to bring together global experts to improve hip health, mobility, and quality of care for children with hip conditions worldwide. And the network is founded on 4 key pillars: community, research, professional development, and growth and outreach. And this past April, we hosted our 2nd annual all members meeting off the backs of the Pediatric Orthopedic Society of North America meeting in Nashville. And we also hosted our 3rd annual Hip Health Day in June. Other activities this year have included sort of setting up a couple of webinar series, as well as bringing hip health experts together to provide a forum for case discussion in Doc Matter. And I really have to point to the incredible efforts of our coordinator, Tamara Dudley, our managing director, Joel Sloan, as well as our Work Learn student, Ryan Hawking, who have really pushed all of this forward. And we're excited to see sort of what the Hip Hope Network holds as we move forward. And moving from Hip Hope Network as a part of Hip Hope Network and all of our Hippy Lab mission, advocacy, outreach, and patient engagement is another vital aspect of the Hippy Lab's work. This has been exemplified by an incredible program developed by our clinic nurse, Sarah. The Hop It Forward program is a new initiative that aims to support families of children with hip disorders who are immobilized post-surgery, either with a spica cast or a rhino cruiser, and to get them access to smart trike strollers. This is a mobility aid that can help support sort of well-being, social interactions, different outings that they might not have been able to do without this mobility. And this really can also connect families that are going through similar journeys. And so huge kudos to Sarah for seeing this program get up and running. And we're also looking to more directly involve patients and families in shaping the research that we do. So our grad student, Denisha, is forming focus groups with patients with DDH and their families caring for children with DDH to gain an understanding of the existing knowledge gaps that could be addressed with improved educational resources or through research, and to understand the patient care journey better. We also hope to, over the long term, really integrate patients and families into research prioritization process. Are we actually researching things that are important to them? And we really want to get at the root of that and have our research be relevant to the people that we're doing this for. And so this is another key aspect of what we're going to be working on moving forward through 2024 and onward. Oops. And finally, a note on sort of patient engagement and education. I'm a Hippy is spearheading the Hip Health campaign. This aims to connect patients and families and provide educational materials to all families of newborns about hip health to promote awareness and early detection. So this campaign rolled out at BC Children's back in May, where every single family of every newborn born at the hospital get a hip health package with a hopper, as you can see sitting up at the front, as well as materials on what to do and what to watch for with their baby's hips. And they're actually getting ready to launch this at a second site at a hospital out in Surrey. But beyond all of our global collaborations in patient engagement and care pathway work, we also have an extremely busy research pipeline. So we currently have 77 studies that are varying stages of the research progress that span from ethics applications through to the publication process. And these studies span a variety of research methodologies with several RCTs or randomized control trials to scoping literature reviews, as well as retrospective chart reviews. They also cover an extensive number of topics: DDH, Perthes trauma, and particularly neuromuscular. The CP hip and neuromuscular has a huge number of studies thanks to our incredibly productive CP clinic team and the amazing research that they do. For some broad highlights, during the academic year of September 2022 to August 2023, our team published 8 research studies that had 44 unique authors represented. And we had 31 presentations and 2 poster presentations at academic conferences with 64 unique authors represented. And this included 5 podium presentations at the Pediatric Orthopedic Society of North America annual meeting back in April, which really speaks to the level of recognition on a global scale that the work the Hippy Lab is doing is gaining. But to highlight a few of some of these more specific research studies, I want to touch on a couple different sort of programs or areas of research. So Perthes disease is one of those areas of focus for our team. And this work is largely led by engineering PhD student Luke Johnson and his supervisor, Dave Wilson. So Perthes is a condition that results in the death of bone cells in the femoral head or the ball of the hip joint. And this can lead to changes in the shape and can cause hip pain and osteoarthritis. And Luke's research is using shape modeling and advanced MRI imaging techniques to better understand and study the long-term outcomes of Perthes in order to develop better tools to manage the long-term impacts of Perthes and improve outcomes for these patients. And another area we are extremely excited. I lost the cursor again, sorry. Okay. So another area we are extremely excited to be exploring is the application of artificial intelligence or machine learning processes across our research. So orthopedic outcomes are largely reliant on imaging with X-rays, ultrasounds, MRIs, and CT scans forming the basis of many objective outcomes. But manual measurement methods, which are typical still, are both time-consuming and prone to human error. This limits our ability to sort of optimize the potential treasure trove of information that we have in our databases through images. So as a result, we have several streams of inquiry in this area, including a collaborative project with UBC engineers led by Dr. Tony Hodgson and his students, which has been funded by the BCCHR Digital Health Accelerator Grant. And for this project, we're looking to improve ultrasound imaging reliability for DDH diagnosis. But we've also established a key collaboration that we're really excited to present with the NIDIS lab at the University of Alberta. I see Xiaobo in the audience came today. He's a postdoctoral fellow working with them. Thanks for coming, Xiaobo. We're working with that team to explore methods to automate image analysis and actually integrate that directly into our databases so that we can increase the feasibility of lower resource sites participating in our research, but also standardize the data across all of our different sites in a cost-effective and time-effective manner. But bringing this all together, our work is only as impactful with effective and far-reaching communication. So it's critical that our research findings are communicated to the appropriate audience in an appropriate way. And consequently, our incredible coordinator, Tamara Dudley, has led efforts to better communicate our work in an effective and understandable way for patients' families, for general public, for other members of the scientific or medical community. And she's done this along with several of our students helping her through digital abstracts. So these abstracts break down key concepts of a complex research study into sort of bite-sized, digestible pieces that are displayed in a digital abstract or a video that is shared on social media. And the goal is to expand the reach, impact, and uptake of new research and clinical knowledge beyond the typical scientific publication audience that we may get. And throughout all of this, a vital piece of our program's research success is the fellowship program. And fittingly, I just see one of our amazing fellows just walked in. And so the fellowship program is prolific, training the most pediatric orthopedic fellows here at BC Children's out of all Canadian institutions. And the surgical fellows are a really important part of our programs. We provide them with research training, support, and infrastructure, but they in turn provide extremely valuable contributions to our ongoing studies and give us a lot of needed clinical and surgical perspective. But beyond their year while they're here, it enables us to establish relationships that become global collaborations when fellows return home and set up their own practices. So we currently have 10 past fellows that are now collaborating partners in various global projects that we have. And there's more to come with our excellent and diverse most recent fellowship class and the current class that are here. And of course, as I said at the start, absolutely none of this would be possible without the contributions of every single member of the incredible Hippy team and all of our collaborators. So while some team members may be transient, they become a forever member of the Hippy Lab family. They never get rid of us. Several of our past team members embarked on exciting new adventures this year. We had 3 Hippy Lab alumni start medical school and 1 start dental school. So shout out to Jackie, Ethan, who else did I get? Sheila and Ashleen for their next adventures. Pardon? Denisha, of course, but she stayed in as I said, she doesn't leave. She stayed in the Hippy Lab. Denisha also finished, but came back to the Hippy Lab as a grad student. And this past year, we also saw some incredible recognition for members of the team. Dr. Bryn Zomar was the recipient of the BCCHR Outstanding Achievement Award for a postdoctoral fellow. And Luke Johnson was one of only 13 recipients of a PhD salary award from Arthritis Society Canada. And of course, our incredible visionary leader, Kishore Mulpuri, was awarded the Canadian Orthopedic Association's inaugural Changemaker Award in recognition of his leadership, advocacy, humanitarianism, and outstanding service to the orthopedic community. So Kishore, we are so lucky to work with you and be able to experience your passion, dedication, and energy every single day. So thank you. And with that, we just want to thank again all of you for attending, all of our collaborators, and especially all of our supporters, our incredible supporters, as Kishore highlighted at the beginning. And I don't know if you want to say a few words at the end, Kishore, as well. Thanks, everyone.
Okay. I thank you everyone for listening, and we'll probably, as you've seen, I think this is an amazing amount of work that's kind of crammed into probably 30 minutes, and it's like we're truly inspired by every single person that contributes to the mission, and more importantly, I think a lot of people that are not here that collaborate with us, that share their data, their journey, and their experience, and truly 60 different centers and all different studies that we have. And, we won't be doing what we're doing today without them, and also the patients and families. And Regina Wilkin, who is here representing I'm a Hippy. Regina, I think your passion, your dedication, and your teams is actually what allowed us to expand our program. And it would have taken us probably 10 times longer to be where we are today. Certainly your team put us on hormones to get to where we are and continue this journey. So really a big round of applause for them, because they're truly, I think, wherever we go now, and this team is recognized, and incredible vision that you had about this branding for Hippy, where we're all hippies. I mean, including the patients. I had a 4-year-old girl yesterday, and she's asking me, "Are you a hippie?" I said, "Yeah, I'm a hippie." So thanks for the amazing work that everybody does. But I think our really unsung heroes are our clinical team, and who also does amazing amount of research. And I know Emily mentioned that in passing, that our cerebral palsy team, incredibly proud of them, and they are busy clinicians, but do some of this research and teaching and advocacy work on the side of their desk. And they've been incredibly productive and viewed as leaders in their own space in cerebral palsy, especially in the area of cerebral palsy hip. Whether that is Jen Farr, who helps with coordinating or assisting with the hip solence program, or Stacy Miller, our incredible therapist and nurse, now a nurse practitioner. And it's really that amazing work that they all do to help us to actually move things forward. And again, the exciting thing for us is we've got the data management team here who helped us when we're thinking about moving a large database from US to here. And I think 2013 or 2014, and their real passion and dedication to help us to actually move the database is actually what got us started. And they continue to innovate, and there's nothing that these people won't do. And we keep throwing some complex, challenging databases and issues at them, and they keep delivering every single time. So thank you so much for your dedication and passion. Not sure, can we take any questions from our audience? Is there?
Yeah, in online if they want to.
On the chat.
Yeah.
Or the audience here. If they want to ask questions, they can.
Yeah, do you have any questions, comments from anyone that's online?
The audience here needs to press the buttons on the
Yeah.
front.
Yeah. Now, are we able to see who's online?
Yeah, there's been over 30 people throughout the time. It's hard to share, but there's been a This is my, and how many people would stay in the room?
Yeah, probably around that. Yeah. Great. So I really like to thank everyone. I think one amazing thing is this amazing report that gets put out every year. And for our communications, and we have Beth, who is not here, who does communications on behalf of I'm a Hippie, but for our Hippie lab, really person that deserves a lot of credit for our communication and many other things that in terms of organizational skills is Tamara. Tamara, thank you so much. And she did all of this in the last 1 week, putting this together. And every year, wherever I go and I show the report and they go, who put this together? And I know there's a lot of people that contribute, but Tamara, you single-handedly pull this together every single year. And so thank you very much for your passion and dedication to actually communicate externally what this lab does. So I was just browsing through this, really proud of, I think, all the work that's done. But thank you, Tamara. Big round of applause for Tamara. And we have a lot of learners here, and our co-op students, I call them transitory. They come and they go off to bigger and better things. And I don't think you realize the impact that you create. And I don't want to list here, but a number of projects, what you see now are things that someone like you started 7 or 8 years ago, working with either Emily or Stacy. So it's or Maria or somebody else in the team. So your contributions are really valuable, even though you might think, I don't know what I'm doing here for a year. You may come back 8 years later, some small seed that you started has grown into a big plant. And so please do know that you do very important work. And we really appreciate what you do. We might not be spending as much time as we could with all of you, but you're doing really important work. So thank you for everything you do. I'd like to recognize Ryan, who's in the audience. Ryan, on behalf of all of your admin team, we won't be able to do this without, your team support. And I could not think of a better time on this site where the leadership is so aligned with the mission of improving care for everyone. When I say everyone, really everyone, whether here and beyond. So please take our heartfelt thanks to everybody on behalf of the Hippy Lab and I'm a Hippie and everybody else. Thank you, Ryan. Hey, does anybody here in the audience have any questions or comments? Regina?
Yeah, I just wanted, on behalf of the I'm a Hippie team, the board of directors, the gala committee, and everybody who works with us, I just wanted to congratulate your team, this team again, for yet again another successful year. Every year, I think, how can you outdo yourselves next year, and you find a way of doing it. And so it's such a privilege to support the work that you guys do. And just once again, congratulations, and look forward to next year.
Thank you. And as we always say, we're just getting started. So thank you. Thanks for all of your help, and thanks for being here. And look forward to seeing you, those of you that are here, out for a little reception. And please enjoy this holiday season, and looking forward to another productive next year. And we're happy to take any comments, I know, or anything that you have. Please do reach out. And if you have any other exciting ideas that you want, then we're happy to collaborate. As Emily mentioned about our fellows, and Drew, who is here all the way from Australia, is already asking about ways in which that he can get involved and he can contribute. So Drew, thanks for, I think, making a big trip to come down here, but also contributing to our program, and looking forward to continue to work with, especially your Center Brisbane, which turned out to be one of our biggest collaborators right now. Thank you.